Hi, my name is Pip Inge. I'm one of the medical doctors here at the VIS, and today we're talking about fertility planning. So in preparation for pregnancy, there's a couple of things to think about in advance of that. The first is making sure that you're maximising your general health and wellbeing. So a visit to the GP or one of the VIS doctors to talk about other medical conditions that may impact your pregnancy is really important. Considering things like ensuring vaccinations are up to date, you've had some blood tests to check those bits and pieces can be really helpful as well. It's recommended that you take a folate supplement as well, ideally for up to 3 months before you start trying to conceive. So when you are thinking about trying to have a baby, it's a really good one to start taking. Speaking to one of the VIS dietitians about what's an appropriate supplement for you is a really important step in that process as well. Obviously, in order to have a baby, you need to be able to work out how that's going to happen for you, and that will be dependent on your personal circumstances, if you're with a male partner or a female partner, and there's obviously some variation with that. But if you are looking to conceive naturally, then trying to track your menstrual cycles as a first point of call is really important, so you can realise when it is the right time to ideally be having sex to trying to fall pregnant. If you are looking down that IVF route, things do take time, so be mindful that this isn't something that will happen overnight, so some pre-planning and prior thought to get the process moving is really important too. So the best time to conceive really is what's going to be right for you. There is certainly no right or wrong, but as we get older, things can get a little bit harder. Technically, our peak fertility is probably in our early 20s, which for most people in our generation isn't when we're looking to have babies. Over time, our egg numbers do decline, and if we look at it as a rough estimate, if you were having regular sex in your early 20s, you're about 25% chance of conceiving each cycle. Once you get to your mid-30s, it sort of drops to about 10%. So the rates do go down with time, and often it does take a bit longer to fall pregnant. Saying that, the right time is when it's going to be right for you, what's right for your family, and what works as well within your sporting context as well. There are multiple factors to consider. If you're looking to conceive naturally, there are a couple of things to consider. Obviously, what the aim of our period is each cycle is to allow us a fertile time of the month. So to talk briefly about what that looks like is a normal cycle is around 28 days, but it can be a bit individual depending on the person. Your period is day 1 and you ovulate, which means your body releases an egg about midway through, so around day 14. At that time of ovulation is when ideally the egg is waiting for a sperm. So trying to time having sex around that middle of your cycle can certainly help to conceive, and usually what we say is having sex about every 2 days around that period can be very helpful. The way to do that is to track your menstrual cycle in an app, but there's also other ways in which to look for that time of ovulation. So there's some over-the-counter ovulation tests which are available at pharmacies and supermarkets and those types of things, and everybody is quite individual behind that as well. The sperm normally lasts up to 72 hours. The fastest sperm can be about 30 minutes, the slowest one's a couple of days, and the eggs last about 24 hours. So it really is a bit of a timing game. So from a male perspective, obviously the impact on your body of your partner falling pregnant is much less. You have the capacity to continue to train and compete through that pregnancy, which gives you a lot more flexibility behind that. What you can do to help in these circumstances is to ideally have healthy sperm. And the best thing you can do to do that is to continue to lead a very healthy lifestyle, which we assume most athletes do anyway. Obviously, if things aren't working the way you and your partner planned and you're not falling pregnant, there can be male reasons as well as female reasons for infertility. Often it's assumed it is a female-specific issue, but it's really important to acknowledge that there are some things we need to check out from a male perspective as well in that setting. If you are looking to time having a baby, it's really challenging. In a perfect world, a lot of people will say, I've got my major event on October 1, I want to fall pregnant on October 2. And we'd love to say that's going to happen, but very few people can get that right to a T. So be mindful that it can take time to fall pregnant. Most people take about 6 months to fall pregnant naturally. Some can take longer than that, and others get really lucky and fall pregnant straight away. So once you are looking to come off contraception and start trying to fall pregnant, be wary that it may happen straight away, but it might be a bit of a longer process behind that. Obviously, there's complications with being an athlete. In order to do your job, you need to be physically fit, and being pregnant certainly precludes you from being able to do that to your full capacity for at least a period of time. So looking around major events and timing of those sort of things, a lot of people will choose to delay starting to conceive until after a major event, but be mindful that delaying that year on year can make things more difficult in the long term as well.